morning. I am Dr. Munmun Ghosh, Assistant Professor of Bashundhara Ad-din Medical College. Today I discuss something in cardiac cycle. What is cardiac cycle? The cyclical repetition of cardiac events that occur from the beginning of one heartbeat to the beginning of the next. This is cardiac cycle. Now I discuss cardiac cycle time. The duration of cardiac cycle time is 0.8 second. How I calculate this cardiac cycle time? Cardiac cycle time is calculated by 1 by heart rate. Cardiac cycle time is 1 by heart rate. I know that heart rate is 75 beats per minute. So 75 divided by 60. This is cardiac cycle time. Cardiac cycle time is 0.8 second. I calculate by this equation cardiac cycle time is 0.8 second. So, cardiac cycle time is inversely proportional to the heart rate. If the heart rate is increased, cardiac cycle time will be decreased. Now, I discuss what are the events occur during cardiac cycle. In the question, there are two type of question is there is events of cardiac cycle and what are the changes occur during cardiac cycle. This question answer is different. When the question says that what are the events of cardiac cycle, then you wrote that there are two type of events occur in cardiac cycle, that is atrial event and ventricular event. Atrial event is atrial systole, this portion is atrial systole and duration is 0.1 second and atrial diastole. Atrial event is atrial systole and atrial diastole and ventricular event is ventricular systole and ventricular diastole. Duration of atrial systole is 0.1 second and atrial diastole is 0.7 second. So, 0.1 plus 0.7 is 0.8 second. So, cardiac cycle previously I told cardiac cycle time is 0.8 second. Atrial systole 0.1 and atrial diastole 0.7 second. And in case of ventricular systole, this is ventricular systole and duration of ventricular systole is 0.3 second and this is ventricular diastole and duration of ventricular diastole is 0.5 second. So, 0.3 plus 0.5 is 0.8 second. So, cardiac cycle time is 0.8 second. And in the ventricular systole there is three phases present, that is isometric contraction phase, rapid ejection phase and slow ejection phase. And ventricular diastole there is 5 stages present, that is protodiastolic period, isovolumetric relaxation period, fast rapid filling phase, slow filling phase and last rapid filling phase. This is the overall events of cardiac cycle. Now I discuss what are the changes occur during cardiac cycle. This figure show the changes occur during cardiac cycle, that is pressure change, volume change, electrical activity of the heart that is recorded by electrocardiogram and production of heart sound which are recorded by phonocardiogram. This figure show mainly the changes occur during cardiac cycle, that is pressure change, volume change, ECG change and production of heart sound that is recorded by phonocardiogram. Now I discuss mainly pressure change. This red color curve show the pressure change in the left ventricle and this dot curve show the pressure change in the atria, that is atrial pressure change, and this dot figure show the pressure change in the aorta or pulmonary artery. Mainly this figure show the pressure change in the left ventricle. So, this is the aortic pressure change curve. Okay. And this pressure change, this is from here to here, this is ventricular systole and from here to here it is ventricular diastole. Previously I told what are the events of cardiac cycle, ventricular systole and diastole. Ventricular systole starts from here to and ends here and ventricular diastole start from here and ends here. and an atrial events. In case of atrial event, there are two events, atrial systole and diastole. This portion only atrial systole, and this portion is atrial diastole, and from here to here total time is 0.8 second, that is 1 cardiac cycle time. In ventricular systole there is 3 phase present. I also previously told in this figure. This is only this portion is isovolumic contraction phase, and this is rapid ejection phase, and this is slow ejection phase. This is ventricular systole, and from here ventricular diastole starts. This small area is protodiastolic period. This is isovolumic relaxation period. This is fast rapid filling phase. This is slow filling phase or diastasis, and this portion is last rapid filling phase, and this phase is coincide with atrial systole, and duration of atrial systole is 0.1 second, and last rapid filling phase is also 0.1 second. Now, I briefly discuss the curve of the pressure change curve in the left ventricle. In isovolumic contraction phase, systole, what is systole? Systole means contraction, either it is ventricle or atrium. In isovolumic contraction phase, the ventricular systole isovolumic contraction phase, ventricle is contact. So, ventricular pressure is rises. When the pressure is rises above this atrial pressure, this is atrial pressure curve, and this red color is ventricular pressure curve. In ventricular systole, ventricle is contact and interventricular pressure is rises. When the pressure rises above this atrial pressure, then AV valve is closed and produce the first heart sound. Then ventricle contact and interventricular pressure is also rises. Ventricle contact and interventricular pressure is also rises. When the pressure rises above this 80 millimeter of mercury and pressure rises above this aortic pressure, then aortic valve is open and ends of the isovolumic contraction phase. So, before the opening of the aortic valve remain closed. In this phase, AV valve is closed and aortic valve remain closed. So, no blood is pumped out by the ventricle. So, there is no volume change occur in the ventricle. That is, the volume remains in the ventricle during this phase is 130 ml. This is ejection period. There are two phases in the ejection period. This is rapid ejection phase, this is slow ejection phase. Rapid ejection phase is 1/3 of the total period of the ejection, and during this phase ventricle is contact and about 70% of blood is pumped out by the ventricle into the aorta or pulmonary artery. So, ventricle blood pumped out by the ventricle. So, interventricular volume is decreased rapidly. This curve show the interventricular volume is decreased rapidly in this period, and this is slow ejection period. During this period, ventricle about last 2/3 period of the total ejection period, and about 30% blood is pumped out by the ventricle. So, interventricular pressure is also decreased, and during this period and the end of the ventricular systole, the volume of blood remaining in the ventricle, it is about 50 ml. So, I told the ventricular events, what are the changes of the pressure change and volume change occurred in the ventricular systole, that is isovolumic contraction phase, ejection period, rapid ejection period and slow ejection period. Now, I told the ventricular diastole. In ventricular diastole, duration of ventricular diastole is 0.5 second. I previously also told, and the phase of the ventricular diastole is protodiastolic period, isovolumic relaxation period, fast rapid filling phase, diastasis and last rapid filling phase. This is protodiastolic period. This phase starts end of the ejection period and beginning of the ventricular diastole. This is protodiastolic period. This protodiastolic period, diastole means relaxation. So during the ventricular diastole, ventricle is relaxed, so interventricular pressure is false. So when the ventricular pressure is false below the aortic pressure, this is aortic pressure curve. When the ventricular pressure is false below the aortic pressure, then aortic valve is closed and it produces the second heart sound. So second heart sound is produced by when the aortic valve is closed and produce the second heart sound. And this closure of the aortic valve, there is ending of the protodiastolic period. During this phase, it is the short duration time of the period of the ventricular diastole, and during this phase there is no filling occur in the ventricle. So ventricular volume does not change during this phase. Now I told isovolumic relaxation period. Isovolumic relaxation period is beginning with the opening or closing of the aortic valve, closing of the aortic valve, and ventricle is relaxed, so interventricular pressure is falls rapidly. When the ventricular pressure falls below the atrial pressure, this curve is atrial pressure. When the ventricular pressure is falls below the atrial pressure, then AV valve is open. During before the opening of the AV valve, so aortic valve closed and AV valve is remain closed. So there is no entry of the blood into the ventricle. So interventricular volume is not changed. That remains above before the that remains, that is 50 ml. So interventricular volume does not change in this phase because both valve is closed, so there is no entry of the blood into the ventricle, and this phase ventricular pressure is falls rapidly. Now I told first rapid filling phase. First rapid filling phase, when the AV valve is open, rush of blood come out from the atrium to the ventricle. So for this region interventricular volume is rises rapidly, and this is diastasis. During this phase, small ventricle is also remain relaxed and small amount of blood comes from the atrium to the ventricle, so interventricular pressure is rises slightly. And last rapid filling phase is coincide with the atrial systole. About 20% of the blood during the atrial systole come from the atrium to the diastole. For this region interventricular volume is rises during this period, and the end of the diastole, the volume remain in the ventricle is about 130 ml. At the end of the ventricle, the volume of blood remain in the ventricle is 130 ml, and this is the end diastolic volume. And here I see that this is the end of the systole. End of the systole, the volume of blood remain in the ventricle, that is 50 ml. This is end systolic volume. তাহলে আমাদের যেটা পরীক্ষায় যেটা কোশ্চেনে আসে, হোয়াট ইজ এন্ড ডায়াস্টোলিক ভলিউম and what is end systolic volume. End systolic volume means the volume of blood that remain in the ventricle at the end of the ventricular systole, that this is end systolic volume, and amount of end systolic volume is 50 ml. This is 50 ml. When the ventricular systole is ends 50 ml, so end systolic volume is 50 ml. And what is end diastolic volume? The volume of blood that remain in the ventricle at the end of the ventricular diastole. This is end diastolic volume, and this is the end, this is the diastole, ventricular diastole, and the end of the ventricular diastole, the volume of blood remain in the ventricle is 130 ml. This is end diastolic volume. This is overall pressure change and volume change occur in the cardiac cycle. Thanks.